There are some unfortunate patients who suffer from a chronic cough due to an underlying sensory neuropathy. A diagnosis of exclusion, such a neurogenic cough or laryngeal sensory neuropathy, is often treated with a neuromodulating drug like amitriptyline or gabapentin. However, some patients may benefit from a superior laryngeal nerve block, which may significantly reduce the overall cough frequency and severity. A superior laryngeal nerve block is performed by injecting a mixture of a numbing agent and a steroid into the region where the nerve enters the voice box between the hyoid bone and thyroid cartilage. This nerve block acts upon the superior laryngeal nerve, which is the nerve that provides sensation to the throat. A neurogenic cough is felt to be due to injury to this specific nerve. This injection may need to be performed several times on both sides to achieve an effect.